what I wanted to start out with is letting everybody know we have a Veterinary Ozone Therapy Summit that's going to be coming up on Friday. So that is just in a couple days, and it's going to be a whole afternoon. So from 1 o'clock to 5 o'clock p.m. Eastern Standard Time. We're going to be just really diving into ozone therapy. And this is the first time I've kind of done this format. It's a 4-hour event. It's free. Like I said, it's obviously everything is online these days. So it's going to be really cool. We have a number of different people who are going to be speaking. There's a couple that I'm excited about because I haven't heard them speak yet. Dr. Rapusek, who's from Romania, he's actually in one of the universities there and did his thesis on ozone therapy, I think 3 or 4 years ago, and now is working in research. And then Dr. Joaquim, who's from Brazil. I've talked to both these guys. Their English is excellent, which I'm always excited about, and they really know ozone therapy. So I'm really excited to hear what they have to say, along with some of the other people who I've, been around, like Dr. Shoemaker and Dr. Siegel and Dr. Roman for quite a while now and know them fairly well. So join us for that. You can register online if you go to o3vets.com/summit. You can register there for this event. And even if you can't make it, I would encourage everybody to come because you'll get a recording of it if you just register. So that's the first thing. The next thing is there's something I announced just recently. It's called the Innovative Veterinary Medicine Conference. This is something that we're actually putting together this year. And I'll tell you why. And I'm very excited about it. Just a couple slides here. It's because I think there's a great lack of a good bridge between traditional medicine and what we get tagged as a lot of times alternative medicine. So that integrative medicine type doctor, just like Dr. Holder and many others are. And so what we've put together is an online conference. It's all online, and it couldn't come at a better time, I think. We're going to be doing it this summer, so it was kind of good timing there. Just didn't know that was going to happen. But and the goal is to go beyond drugs and surgery with evidence-based veterinary care. So we put together a panel of veterinarians, and they're helping to kind of structure this, and it's going to be extremely affordable. It's going to look a lot like an actual conference. So you actually go in, you go to a lobby, there's a lounge, there's a lecture hall, there's an exhibit booth, and you have exhibitors there. So we try to mimic a real conference as well as we can. And I'm noticing these slides are in a different format. They're kind of scrunched together, but oh well. So it's really neat. The cost, again, like I said, is really affordable. It's $49 a person for a veterinarian, $29 for a student, and for a whole clinic, it's $159. So you can register, join us for that. It'll be this summer. We're still working on the schedule, so that's not up on the website yet, but we're going to be getting some of that up very, very, very soon. If you go to ivmconference.com, you'll see some of that stuff. So with that being said, I'm going to stop that slide presentation, and I'm going to ask Dr. Holder. I met Dr. Holder a couple of years ago now, I think, if I'm not mistaken, at a HVMA conference, and specifically our training before the conference.
Yes.
Is that right?
Yep.
Yeah. So tell us a little bit about yourself.
Well, I graduated from the University of Florida College of Veterinary Medicine in 2002, go Gators, and opened up my practice in 2004. So I was one of those crazy gunners who decided that I wanted to be an owner and I wanted to do things my way, and my way was definitely practicing integrative medicine. And currently we are a 5-doctor practice, a very busy practice in DeLand, Florida. And we see avian exotics, cats and dogs. And we have great many tools to help patients. We see now we're more of a referral clinic for cancers and autoimmune disease, and so we really pride ourselves on being able to help patients exactly like what your summit is about in those ways.
Awesome. Well, thank you for being here tonight. I know it's sometimes hard to take a little bit more time out of a busy schedule. And I think we're both at home. I'm at home. So if you hear kids in the background, like I said, I have 5 of them here somewhere. If you hear things going on, that's what's happening. So if the connections, if we have any trouble, I may reset the room. Hope not to have to do that. It'll only take a few seconds if that happens, just to let you guys know. But let us know if you're having connection problems during the webinar. Usually it's just 1 or 2 people, and you just need to reboot you reconnect, and you'll be good to go. But sometimes we do have those issues. So I have a huge storm. I hear a ton of rain outside, so we'll see. With nothing further ado, then I'm going to actually put your presentation up, Dr. Holder, on the screen, and we'll just jump into it. I'll let you take it from here.
Thank you. So hope everybody is safe and healthy, and thanks so much for joining me tonight and O3 Vets. I'm super excited to present some of the things that we do at Florida Wild Veterinary Hospital and some of the ways that we use ozone therapy. It's been a game changer for us at Florida Wild. I did graduate from 2002 and then went to the Chi Institute for acupuncture and Chinese medicine training in 2004, got my acupuncture degree, and have just spent my life pursuing alternative therapies because I feel there's just so much of a better way in treating root cause of disease. And about 5 years ago, my nephew was diagnosed with cancer, and he's cancer-free and doing great. And then that prompted me into Frank Schallenberger's world and learning about ozone therapy. And then I met up with Jonathan, and the rest is history. And so we've been using it. We literally use it every single day, all day long at my practice, and it's a game changer for us.
Awesome.
So, yeah.
Hey, real quick, before you get going again, just let people know if you have questions, chat them into the side panel. I failed to mention that, so just let us know if you do, and we'll try to get to those.
Yeah. Ask away, anything, especially if something's not clear, just fire at me. So I just wanted to present, before I talk about some cool cases, some ways that we use ozone therapy and how it expands every day for us. We're always, like I said, we have 5 doctors, we have doctors' rounds, and we have so many modalities of healing that it's very important for us to say, oh, don't forget about ozone. Oh, don't forget about other things that we do. And so we've made it a standard of care in our practice to use ozone therapy. Every single ear infection or ear inflammation that comes in, the door gets an ear flushed with ozonated saline. And the healing, number one, is much greater. The pain is reduced. And it's very often that we don't have to retreat. Before we were using ozone therapy, we would have to retreat ear infections often. And this is a big thing in Florida, ear infections, skin disease. And so incorporating ozone into all of our ear treatments has been really wonderful.
I hate to interrupt already, but I have a question already. So I'm going to do that. So with your ears, because there's a lot of people I talk to who have ear, conditions going on, and trying to treat those as a veterinarian. Tell me really quickly what your protocol would be for a chronic ear infection.
So a really nasty ear infection, if we've cultured, say, Pseudomonas, and that's going to be pretty resistant infection, we're actually going to do 3 ozone treatments. So what I'm going to do is I'm going to fill the ear canals with ozonated saline. I'm going to hold the ear flaps closed for about 3 or 4 minutes. We're going to let them shake. The ozonated saline is going to come out, and we're going to do that again 3 times. That seems to have worked the best for us. If it's just a first offender ear infection, they're coming in, we're just going to flush the ears like we would normally. We just use ozonated saline.
Okay. Do you dry the ears after that? I mean, after you flush it with saline, is there a drying agent used or anything else?
No. What we do is just put the medicine right in.
Okay.
So we don't, what we'll do is we'll clean it out. So we are kind of drying it because we're using Q-tips and soft cotton to try and get the debris out, but we don't use anything else beyond medication after that.
So you'll clean it out after you ozonate it or
Yes.
before?
Yes.
Okay.
Yeah. So we'll use the ozonated saline basically like our ear cleaner.
Okay.
Yeah. But for those bad cases, we'll actually keep the contact of the ozonated saline in the ear canal for a while. And there was one patient that I don't have a report on, but did not have to go to surgery. It was a Cocker Spaniel we thought we were going to have to take to surgery. And we ended up being able to control the ears with the ozonated saline. And that was the only new thing that we had done with it.
Awesome.
And not too long ago, we had some skin cases where we were culturing MRSA. And it's just very difficult to treat, and it's frustrating. And so one of my associates had the idea to just bring this client and patient back in and to do the ozonated saline baths every day. And it was a huge commitment for the owner, but the results were fantastic. We cultured the patient, they cultured negative. And so now we just use it on not just MRSA cases, but any type of skin infection where there's inflammation. We bubble the saline and then we will rinse the patient, and then we'll rinse the patient again, and just kind of let this ozonated saline sit on the patient for a while. We let them air dry after that. One of the coolest new things that we're doing that I'm super excited about is we're treating corneal ulcers, any type of ocular inflammation. I had a cat patient that was actually born with no eyelids on one side of the eye, and so the eyelids were rolling in and the hair on the skin was scratching the cornea. And so we took that cat to surgery and I did eyelid repair, and then sent that owner home with a jar of ozonated saline and told her immediately go and put this into ice cube trays, and then twice a day thaw that ice cube tray or ice cube out and use those as drops into the eye. And so where that cat had a completely covered, scarred cornea, at 2 weeks after using ozonated saline every day, the cat had vision around. There still was some central corneal scar, but the cat had vision around it. So I just learned that we could freeze the ozonated saline and it stays indefinitely. And for me, that was super exciting because the bringing of the patients back in over and over can be difficult. So we also have a standard of care in our practice with dentals. Every single dental gets ozonated saline and rectal ozone. They get ozonated saline as a flush after they've been scraped. And we also use gas injected into any type of extraction sites, or we'll use ozonated saline. And then after we've done all of the oral work that we're going to do, we're then going to use the olive oil, ozonated olive oil, and we're going to coat the gums at the gum line of the teeth with the ozonated olive oil. We see almost no dehiscence. We see fantastic recovery. Every once in a while, we'll get potentially a suture reaction, but even those I feel like are less and less since we've been using the ozonated saline. We've been doing that for about 2 years now, and we're just super pleased with it. All wounds, every wound that we see, we're going to use some type of ozonated saline, flush, ozonated cream. I typically stay away from the oil on animals because it's greasy, except for the mouth. That tends to work really well. For some of our pododermatitis cases, so those are cases of infection in the feet, and those can be really difficult. And where we are, of course, addressing underlying causes, we want to use something to help bring down the inflammation. And my associate doctor actually tried the ozone cream and was just really blown away with a few of our patients. So
is that the pet liniment?
Pet liniment, yeah. So. Awesome. We're just using that every once in a while. It's a little bit strong for our dogs. And so I tell owners that's probably the only time on the feet that it may bother them. And so so we do warn the owners that that's the case. If that's the case, we'll swap it out for something else. But when it works really great.
Okay, so real quick here again, we have a couple people. I knew this would be a topic of interest. So with the ozonated saline and actually freezing that. So there's a bit of information available on, ozonated fluids and keeping them stored. There's a couple of things to note too, to add on top of what you said, Dr. Holder, which is one, if you want to store it, keeping it cold as possible is going to allow it to last longer. Number two, if you can put it in a glass container with a Teflon lid, we actually have some of those for sale at o3vets.com. That's the best way to store it in a refrigerator, because it won't react with the plastics then.
Yes, that's a great point. Yep, it has to be glass.
Those things. And then it will, even if it's frozen, it will break down. It's just going to slow that process down a little bit. And so just keep that in mind. But I do encourage people, at least, they can get 3-4 days out of it, maybe a week even, potentially. But do recognize that it's going to be reducing it, the concentration as it goes there. It's not like an oil quite, where we can put an oil in the fridge and it'll last for years.
Yeah, and for the patients who need it several times a day, it's just amazing that they don't have to come into the practice. And we have a lot of people that travel a long way, so it makes life really easily. But our cat, we did get 2 weeks treatment, but I wasn't there thawing it, smelling it, so I don't know the content of ozone by the second week. So
sure, yeah,
so that's awesome. Okay, so anal gland abscesses, anywhere there's infection, anywhere that there is stinkiness, we're going to use some type of ozonated saline. We use it intraoperatively when we are closing up an enterotomy, any type of contamination, cystotomy, we're going to use an ozonated saline flush, and that works really well. I did say we do see avian and exotics, and so we're going to use these skin infections. We're going to flush with ozonated saline for reptiles. And a cool case that we had yesterday was that sad looking little duck up there that presented to me with an egg stuck in her cloaca for 4 days and on digital palpation. So she's actually lives in a house. She's a handicapped duck that the clients really wanted to save. So she's 4 years old, and she on digital palpation, that egg was very soft and it was adhered to the surrounding tissues. And because it had been so long in her cloaca, super concerned that she's going to get sepsis infection. So I was able to put a needle through her cloaca and rupture the egg. But then once I went in to try and remove the eggshell, it was adhered, and I was very worried about rupturing the cloaca. So we went ahead and used a stainless steel feeding tube, and we did 3 flushes with 60 mils of ozonated saline. And for me, I was doing it just to help with infection, because if you can imagine this soft, rotten egg, once we ruptured it, the stench was so foul. That's funny. That's punny. And and so we flushed the cloaca 3 times, and then once I went in to digitally palpate her cloaca, the eggshell all came out. So we're able to remove all the parts of it, and then I felt really comfortable with having gotten that ozonated saline flush. So that was a first for us with the cloaca flush.
Wow.
So we also use it with injections, not quite as much as we use it in other ways, but we'll put ozonated saline in subcutaneous fluids. For some of our patients who may be receiving fluids and an antibiotic injection, one of my favorite things about ozone, which we'll talk about with a case that I have, is how much it potentiates antibiotics. It's like antibiotics on steroids. I've just never seen anything like it. We'll inject ozonated saline into acupuncture points, particularly immune stimulating acupuncture points. And then we talked about using it as a bladder flush if we need to. Those are some chronic urinary tract infections that we can't get a handle of. The ozonated saline is really fantastic. After a while, some of our urinary tract infections with our dogs will become very resistant, and we're left with not a lot of options. Rectal ozone is just something that we use all day long. Any of our diarrhea cases, if we have small intestinal bacterial overgrowth, we have rectal tumors. Because of Dr. Margot Roman and all her awesome work on microbiome transfers, we follow her protocol and we use rectal ozone prior to all of our microbiome transfers with just pretty incredible success. Every single immunocompromised patient that can afford ozone therapy is going to get ozone therapy. We recommend it in our cancer patients and our patients with any high levels of toxicity. And toxicity not necessarily meaning in the sense that you think like a heavy metal toxicity, but just inflammation. I have not used ozonated saline with transitional cell bladder cancer. I just had a question there.
Yep.
So that would be a great case to use it. We just haven't done that. So our exotic patients. I'm sorry. I should rephrase that. We have used it as UVO3. We have not used it as a bladder flush. So let me just make that clear. I had a patient where the household owners were very sick and their birds started dying. They had a flock of birds, and it took doctor. There is a wonderful exotic doctor at University of Georgia, Dr. Ritchie, and he and I worked for about 2 weeks trying to diagnose what was going with these birds. We finally found out that the owners had a horrific mold toxicity, and so these birds were dying, and we were pretty much thinking of anything we possibly could to save these birds, and so we put the birds on antibiotics because they became immunocompromised, and tried to build up their immune system. And Jonathan actually sent me very small rectal catheters so I could give these birds rectal ozone, and so we did save 2 of the birds, and so that was really exciting.
So a couple more questions there.
Yeah.
What frequency do you use rectal ozone in immune cases?
So meaning dosage, 40?
Yeah, I think how often?
Frequency. So it just depends. Every single thing that we do is tailored to the patient. And so there is ideally, we're going to be able to do UVO3 weekly in our cancer patients in the beginning to see how they respond. Rectal is not as wonderful, but not as powerful as UVO3. So our rectal cases, we want our owners to either get a ozone machine to do it at home, or we have some dedicated owners that'll come in every day or 3 times a week. So the more you can do the rectal, the better.
Yeah, and then how do you do a bladder flush in a cat?
We have not. Yeah,
done
no,
that?
we have not.
Okay.
We use a different modalities for that. All right. And then somebody's had success with TCC in a cat using rectal insufflation.
Yeah, awesome. Dr. Vargas. Yeah.
Awesome. So UVO3, this was an exciting addition to the practice with our immunocompromised patients, our allergy patients. Again, that's a huge deal in Florida. Any of our sepsis patients, our cancer patients, we see awesome response with our lymphoma patients. And so I'm going to present a case about that at the end. Any type of systemic fungal infections, I got a case to present about that, discospondylitis. There's some diseases that we see as veterinarians where there's not a lot that we can do for these patients. We try to manage them as best as possible. And so the ozone and the 2 that I'm going to present are patients that, when we consulted and asked everybody under the sun to please help us with these patients, everybody said, this is going to be a dead animal. So that's why, of course, I chose to present those because they're so exciting. But spondylitis, and infectious spinal cord is very difficult, very painful to treat. And so we've used UVO3 very successfully with our cases. We really like it with congestive heart failure. Anything we can do to increase oxygenation in our patients. Our patients, not that we've measured or able to measure their arterial gases at Florida Wild, but they clinically just do better. They feel better. One of the things that we see with our congestive heart failure patients is that they just don't want to eat after a while because they are on a lot of medications and supplements. And so I feel like the ozone has helped keep their energy level up and their appetite up. Chronic upper respiratory infections, for sure. Anything chronic, anything infection, anything inflammatory, yes, try it with ozone for sure. Okay, so maybe that's a good place to answer any questions before we talk about some two pretty cool cases. Yeah, go ahead.
Yeah, so Peter, yeah, you saw, maybe you were going to talk a little about that. I can also talk about it too. Can you talk a little about ozone, how it slows aging and promotes longevity? So you want to take a shot at that, or you want me to?
It's all about the mitochondria. Yeah. You can.
No, yeah, so exactly. And there's a little bit, obviously we do know about this process, and as we're going to have a webinar here someday soon where we're going to get into some of the nuts and bolts of maybe more basics of ozone therapy. We haven't done that in a while, and what it is. But so I think when we talk about oxygen utilization, you look at any anti-aging doctor or anti-aging treatment, they have to be able to address oxygen utilization, because as Dr. Holder pointed out, you're with mitochondria, with our cells, the Krebs cycle, all of it depends on the nutrients that we bring in through oxygen and oxidation. And so as that suffers, and as the cell's ability to take oxygen in and utilize it to create ATP suffers, well, the mitochondria break down faster, the cells break down faster, and our bodies, or our pets' bodies, end up breaking down faster. So if we can do something to slow that process through increasing oxygen utilization, increasing intracellular communication, cutting inflammation, and a couple of other really core things, we can help slow the process, Peter, like you're talking about, the aging process, and promote longevity.
Yeah, and then I've got a question about, for CHF, do we do rectal or UVO3? And I think the answer is I'm going to use whatever I can, and sometimes that's my patient. So if I have a little teeny Maltese that's in congestive heart failure and repeated venipuncture sticks is more difficult, I'm going to go with rectal ozone. But if I got a patient that's doing great, I had a Yorkie who had lymphoma that lived for 22 months. We incorporated UVO3 into his schedule, and he was a champ. He didn't mind the blood draw at all. And so we were able to do UVO3 with him. So a lot of it's just patient and financial with the clients.
Okay, real quick, I'm going to do a poll here. There's a couple polls I have, and just if you would, I'm interested to know how many people actually are using ozone therapy so far. What percentage? Of people. So if you would just vote on that, that would be great, and we'd get an idea of kind of the people who are in on this. Now, it's not going to answer the question for all those who will watch after the fact. But at least some of those people here, and I'll have one or two more of these during the event. So, okay.
Okay. Are you there?
Yes. Okay. So go ahead, Aaron. Right. I think you can keep going.
So we're going to talk about Shiloh, who at the time of presentation, Shiloh was an 8-year-old male-neutered wolf hybrid. He was truly a friend of mine's, man's best friend. This guy went everywhere with his daddy. And he presented to my associate, in August, and he had a little wound on his forearm. and looked at it. It looked a little bit weird, a little bit deep, but we elected to go ahead and treat it topically and see if he responded. And then he came back very quickly on the 23rd. ADR, ain't doing right, for anybody who doesn't know, and febrile. And so another associate of mine stepped in on this case and went ahead and did a full workup. We did blood work, and he had a high white blood cell count with a neutrophilia, a low albumin of 1.8. Normal for us is 2.4, and anemia of 36. So he had actually had blood work just prior to this that was all normal. And so that was a dramatic decrease or dramatic changes in the blood work very quickly. So we brought him into the hospital to work him up completely. We immediately started re-looking at that wound and took some biopsies of the wound, multiple, so that we could culture. And we also did an abdominal ultrasound, found a small lesion on the spleen, aspirated that lesion. It turned out to be just a lymphoid hyperplasia of the spleen. So nothing exciting. Thoracic radiographs were unremarkable, and the rest of his abdominal ultrasound was normal. So we started limb bagging him. We had just gotten the ozone machine and we are super excited. So we used it on everybody. So we started limb bagging him, started him on a doxycycline Baytril course and intravenous fluid therapy. So the biopsies came back and the culture results were super frustrating for us. Came back as a severe deep separative, basically just blah, 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 super necrotic, infected, but guess what? We have no idea what's causing it. So we were very anxiously awaiting our culture results, negative aerobic, negative anaerobic, and then thought for sure this is going to be some type of fungal infection because he's outside with dad a lot. And every week we get a negative fungal culture for 3 weeks. So we were feeling frustrated. So he's continuing to ride this wave of feeling a little bit better, feeling really puny, not doing great. And on September the 15th, I personally rechecked him and took over his case and saw that he had open oozing wounds on his hips and his sides. And they were very deep. And so at this point, we know there's absolutely a systemic infection. And we're super frustrated that we can't diagnose it, but we're thinking in our mind, this has got to be pitheosis or actinomyces. But whatever it was, Shiloh was dying. He was unresponsive to the treatment. He was just slowly getting worse. The wounds were getting bigger, and it was very frustrating for us. So I just prepared the owner for Shiloh was not gonna make it because we were not able to get a handle on this infection. So we decided to start clindamycin and a low-dose steroid therapy for him. He seemed like he was having just a little bit of vasculitis, and just told the owner, okay, I'm just like gonna throw this, Hail Mary at you. If you will come in every single day, 7 days a week, on Sunday, meet my technicians and get rectal ozone, and every week for 6 weeks get UVO3, maybe we can do something for Shiloh, but please don't get your hopes up. Don't get excited because this is really bad. Whatever we're battling here is really horrible. So he started to do better. He started to feel very good. After about the first week of our therapy, he was slowly showing improvement. The owner was also doing aggressive wound care at home. I had him doing actually essential oils and tea tree oil and things for that, packing his wounds, changing his wounds. That was before I was really using the liniment. Now I would be using the liniment. But and so he was very dedicated. He brought his dog on, and so after about 4 weeks, we really felt like Shiloh was turning the corner. But still, like, you know, this is going to come back. This is going to be a problem. He's going to die from this. You know, he's a friend of mine, so I was able to be very, very frank with him. So after about 6 weeks of therapy, we started to wean Shiloh off of the clindamycin and the pred we took him off clindamycin and weaned him off the pred, and found out that each time we tried to wean him in the beginning off the clindamycin and pred, meanwhile was continuing to do ozone therapy, that he would get a fever and get a little lethargic. And so all of us would get super, super scared. So we go back on the pred, back on the clindamycin. And so we just kept him on a dose of clindamycin and pred, and then and continuing the rectal ozone until February. And in February, we went to 3 times weekly. And then in July of 2018, we went ahead and discontinued the ozone therapy. At this time, Shiloh was doing great. And today, I said sorry about that. Shiloh, he is still alive. He's 11 years old. He is on a physiologic dose of prednisone currently. He gets some ozone every now and then. He has no new wounds since 2018. And right now he's just battling arthritis and old age. So huge success story with this dog. I am 1000% sure that it was the ozone that saved his life.
That's awesome.
Yeah.
So we have a quick question here from Peter again. He says, if you do daily rectal ozone therapy, can that be irritating? Is it going to dry out that area? And what would be the best concentration if done daily?
So
or would it be dependent on the dog?
Yeah. So we were, again, this is the case where it was Hail Mary. And so we did use 40 as our concentration. And we ended up giving him 1.5 times his body weight rectally every single day. And I figured at some point he was going to show irritation, diarrhea, pain, and he did not. Over and over and over, we gave it to him, and he tolerated it great.
Yeah, and I think that's a great protocol. It sounds like. Heather asks, did you use the Pleckner protocol then?
So I do use the Pleckner protocol sometimes, but for him, our concern was he was on prednisone for such a long time that his adrenal glands probably weren't doing what they should have, and it made the owner feel a little bit better. So we just kept him on a physiologic dose of prednisone, but he is not on levothyroxine. He was not a Pleckner case. All right. So yay, Shiloh. Okay. My last case was pretty cool case too. Not cool in the beginning. Chemotherapy extravasation. So we do some chemotherapy. We usually use the CHOP protocol for lymphomas, but it's a very tailored, specific. We go outside the CHOP protocol. We use UVO3 instead of some of the chemotherapy agents. But this owner at the time was like, we're going to do all the things we possibly can do to try and help this kid. So Cookie's our 7-year-old Labrador Retriever that presented to our hospital for lymphadenopathy, and my associate doctor, this was my associate doctor's case until we got the chemotherapy extravasation, and then I jumped in and took over and helped. Where we did the CHOP protocol, followed the CHOP protocol. She did. On April the 19th of 2017, she administered doxorubicin, and before the catheter was flushed properly, the catheter was removed, and just that one drop of doxorubicin came outside of the catheter into the vein.
So I remember. Yeah. I remember we talked about this case like a year or two ago.
Yes, and it's 2017.
Okay, yeah, and I remember you talking to you about it, and it was just such a cool, like, unusual, unique case. So I haven't heard you actually present it yet. So this is exciting.
Yeah, it was
I'm
a
enjoying this.
great case. It was such a great case. So that had never occurred for us. And so we were, of course, instantly terrified. And before we could literally throw the catheter into the chemo bag, his arm was giant, swollen, very, very hot. It was pretty terrifying. So we immediately didn't think of ozone initially, because now we're calling the oncologist to say, okay, guys, is this happened to you? What are we going to do about this? And the oncologist, every single one, we have a Cornell graduate, a University of Florida graduate. We called all the people that we know. We know people out at Texas. Every single oncologist that we talked to said, you will amputate the leg. You will not save this leg. This is a done deal. I'm sorry that it happened to you. But so we called the owner to prepare her that we are absolutely going to have to amputate this leg, but just hang on just a second, because we just got this new ozone machine. And so we're going to do this for free for you, because we're going to try it out. If you can just promise that you can get the dog to us frequently. And she absolutely was just amazing in doing this for us. So the oncologist told us to soak the leg with DMSO and ice the leg down. And so we did. We got maybe a slight improvement with the heat. And then the oncologist said, I guess you can give Zenocard if you want to. You absolutely have to administer it within 24 hours. The outcome's poor. You're going to have to amputate the leg. It's very expensive. You can try the Zenocard if you want to. And so we thought, well, we'll look around and see if we can find it. But we got the extravasation was on the 19th, and we didn't get the Zenocard until the 21st. So here we are now, 48 hours out. We gave 1 dose of Zenocard, and then 3 days later, we followed up with only a half dose. At that time, the owner said, I'm done with chemotherapy. He's going to have an amputation. And so I just don't want to put him through anymore. And so we all said, okay, absolutely. The oncologist warned us that what will happen with his leg is that at about 4 weeks, he is going, or 21 days or 4 weeks, he's going to look like his leg is getting better. And then all of a sudden it's going to rupture open. All the tissue underneath will become necrotic, and his leg is going to slough and fall off. At that time, you have to amputate it. And so we are sitting, waiting, scared to death every single day with this dog. So we said, what have we got to lose? We're going to go major with this kid. And so this was before we actually had our UV O3 machine. So we were doing just major O3 autohemotherapy.
Just ozone, not the UV part?
Yes, not the UV part, yeah. And so we did this 2 times weekly, and we limb bagged him weekly, and we laser therapied over his limb. I wrote limb bag weekly on that. I'm so sorry. We actually, we limb bagged him 2 times weekly with the autohemotherapy. Sorry about that. So we limb bagged him on the same day that we went ahead and did the autohemotherapy. We laser therapied over his limb Monday through Saturday, every single day. And as you're going to see some pictures of it healing next. So in a few weeks, his forearm started to deteriorate. And so we said, oh my God, so we're going to go to daily limb bag, again, what do we have to lose? So we went to every day. She brought him in for us to limb bag him, and we kept his limb in the bag with ozonated gas for 15 minutes. We continued his major autohemotherapy, and we continued to laser him. On 5/25, so we're 4 weeks out, we dropped back his laser and his major O3 and limb bag. We did everything just 2 times weekly. And in June, we actually healed his leg. So you can see here. So this is directly after we started documenting it, because it was a little frightening. I think it was just like a few days after the extravasation. This is his fat, swollen arm. And this is the deterioration of the limb. So here we're thinking, okay, it's happening. It's going to start sloughing and dying. And then we got
Uh-oh, got a little glitch there. Can everybody hear me still? Looks like we've lost Dr. Holder. So she'll join back in here. Yep, she's back in. She'll be something must have happened there. So Peter, really quick to answer your question about the catheter, inserting a catheter for rectal insufflation, about 3 inches is what we recommend. So just to try to keep it close to that portal vein, so you don't have to put it in far. But back to where you were.
Sorry. So that wound healed really quickly and then fur started to grow. When the fur started to regrow, we literally cried in relief. We're like, oh my God. We called Jonathan. We're like, I can't believe it. We called all of our oncologist friends. We're like, guys, we got this leg to heal. And the first thing out of their mouth was, you probably didn't get the doxorubicin extravasation. And so when we sent the pictures, they were like, okay, you did. So what an amazing success story. But just beyond that leg healing, just to say how cool this is that we started chemotherapy in February of 2017. We discontinued the therapy just a few months after. And of course, we hammered Cookie with ozone, trying to get his leg to heal. And then we continued his monthly major O3 until January of 2018. So Cookie came out of remission and we did euthanize at that time, but that's just to be said as 9 months in remission with only ozone therapy. And that is pretty flippin' awesome. So at the end of all this, the owner was deeply, deeply thankful, and it turned out to be a pretty awesome case for us.
That is awesome. So I have a couple questions, but there's a couple people who asked other questions.
Yes.
I'll ask theirs first. So what was your concentration? Do you have any idea for the limb begging?
I think at that time we just cranked it all the way up.
Yeah.
We were operating with fear.
Yeah, probably somewhere between 60 and 80 micrograms per milliliter then.
I feel like it was 80.
Yeah.
And I think when we called you, I think we were all like, we don't know, like this is uncharted territory, so just do some things.
Well, yeah, and for limb begging, a lot of times, high concentration initially is a good idea anyway. So
yeah.
And then somebody wanted to know what the Pleckner protocol was and what was the laser type or class that was used as well.
So, that's a good point. That was a class 4 companion animal laser that we used. The Pleckner protocol is online. Dr. Al Pleckner is a veterinarian who worked hard on trying to determine hormonal imbalances in animals and threw out some theories that I think are appropriate in some species, not across the board, but that our adrenal glands and sex hormones are disruptive in the body. And so he did a great job with his work.
And what kind of cancer did Cookie have?
Lymphoma.
Okay.
Yeah.
All right. So what do you think? What do you think the ozone therapy actually did? Why did this work so well on this particular issue? Any ideas there?
I do feel like that is highly effective with lymphoma patients, and so I don't know. I don't know if we are harnessing the body's immune system and it's able to keep it in check. I don't know if we're seeing any anti-cancer effects with it. I don't know exactly. We're certainly not injecting the ozone therapy into the lymph nodes or into the tumor to act directly. It's just a systemic effect that it's having.
Yeah, and in particular with this leg, though, and the how do you pronounce it? Diarubicin or whatever it was.
Doxorubicin, yeah.
Doxorubicin. That's just a unique case to me. I haven't, come across.
Why did it heal it? And I don't know if it was just bringing in blood supply. I mean, if it was just You
Yeah.
know, I don't know. But one thing that was pretty interesting that we saw, and we kind of freaked out a little bit with it, with the ozone, the major and the limb bagging, and we were doing such aggressive ozone therapy that when he would come in, we would start to see little teeny bumps all over his body, and then they would go away by the next visit. And so we almost felt like he was literally like detoxing out of his skin. And that's one way that we were seeing it come out, because they would heal and then they would come back. We would make them come back with the ozone and then they would heal.
Well, I know a couple other doctors who've had cases like this where, like you've said, we're scared about what's going to happen, and so we just kind of are hitting them really hard with all of these things and with ozone every day, and we're doing multiple different administration methods and stuff. And some of the best cases that I've heard about is exactly those ones.
Yep, I agree.
So I don't know if there's, and that's part of the debate between kind of like a high dose ozone approach versus a low dose approach, and how much can the body handle. And it's, there's a bit of back and forth there, and the bottom line is we don't know exactly, but sometimes it does seem to work better if you're hitting them a little bit. One question from Dr. O'Leary again here: cytokine damage, oxidative damage from the doxorubicin was counteracted by ozone?
Maybe.
I guess it's a statement question.
Yeah. Yeah.
Yeah. So, okay, is that a? I'm sorry, I didn't know if that's the end of your.
Yeah, I'm done. Oh wait.
Okay. Okay, there was one more. Okay. Any other questions? Just chat them into the side there, guys. I'm gonna let's see here. What I wanted to do, I'm going to throw up something, just an offer for you. This is something I'm kind of excited about, just because it's a newer product, and it makes ozone therapy easy. And so the easier we can make it, the better. So these are ozonated olive oil suppositories. So especially, I don't think it should probably replace rectal insufflation at all. It's a definitely more gentle form, but maybe for those clients who don't have a machine at home, but you want them to be doing something at home, sending them home with a bottle of the suppositories is a great, just continued way to be treating them with ozone during those times where they're not in the clinic. So that's there and available on our website, 20% off right now for you guys for the next few hours at least. So take a look at that if you haven't yet. So I am just going to encourage you guys to, Dr. Holder has been a great resource for us. I'm really thankful for her having come through the O3 Vets training and really helped, in things like this, just presenting and being really supportive. And, I'll be frank here and I'll be honest. So for some reason or another, the ozonettes that we sell, they've had the most trouble of any clinic by far with that machine, but they've been very patient with us. and it just, so I have no clue why, no clue why, but it's not their fault. But they've been very patient, very kind, and I really appreciate that, because that can be annoying. But anyways, I love what you guys are doing. Thankful for it, and thank you for your time tonight. Guys, remember a couple things: the Innovative Veterinary Medicine Conference. You can register for it now. It's not going to cost you much to do that. You'll be set to go. We're going to have an awesome lineup. We have a great group of vets who's involved in helping kind of put this together. So I'm really excited to see where that goes. And if you haven't yet registered for the summit on Friday, just go and register for that on our website, o3vets.com/summit. If you have any trouble with that, just shoot me an email, and I will get you registered for that as well for Friday. One other question by Dr. Bozeman. Hey, Dr. Bozeman, good to see you. What do you think about rubbing the ozonated oil under the nose for corona exposure?
So I will answer that, because when that cap goes off of the ozonated oil in the dentistry room, I can smell it about 20 feet away, and it is so powerful. So probably if you can tolerate it, it might help. But by far, I mean, even the liniment has a strong smell, but it dissipates really quickly, and the oil does not dissipate. It stays. Ooh, it's powerful.
Agreed. And so, yeah, I think I would agree, So maybe the liniment, if you go to honest03.com, you can find those products as well, or there's some for human use, some for vet use. And those might be a little more gentle, like Dr. Holder is saying, instead of maybe an ozonated oil to rub under your nose. But I think it's a good idea. The ozonated suppositories and rectal insufflation at home are, I think, good to help our immune systems at the very least, and to help fight some of this stuff that's going around. So,
absolutely.
Okay, so yes, we are recording this. It will be available probably tomorrow. I should have it up on our YouTube channel. So if you want to watch, or you have people who you're going to share this with, we'll have it available on our YouTube channel here tomorrow. So you can just send them over there, youtube.com/O3vets, and you'll find us there. Any final comments, Dr. Holder?
Yes, if you're not using ozone, get on the bus and use ozone. There's no reason not to. It doesn't hurt any animals. Jonathan is not paying me to say that. It really is amazing. It's amazing. Yeah, and we try not to panic when our ozone machine goes down, because we have to use it all day long, every day.
Now you have a backup. Yeah, right.
Yeah, we had to get the backup.
But it's not typically the case. Just for some reason or another, Dr. Holder, yes, it has been for you guys. A couple people saying thank you so much. Good questions. So thank you guys for hanging in there with us to the end. This has been enjoyable for me, and I look forward to seeing many of you, I'm sure, on Friday. So that is it for this evening. Have a great night. Be safe.